Hi everyone, this is Dr. Khan, Executive Plastic Surgery. So Bloomfield Hills, Michigan. This is another Facebook Live. Now I want to go ahead and kind of get you engaged too, so that you can see what I see on a regular daily basis. Ultimately, you hear the patients, but you want to see what we see inside the operating room. So over here we have 116-2025, initials VM, a local patient, literally walking distance from here. En Bloc, complete En Bloc. So you have, you know, grade 3 contracture is what she had on the right side, capsular contracture. And as you can see, I removed some scar tissue. She had a left in 16, that's when her implant was. I'm very happy with how the whole dissection has gone. This was under the muscle, very tedious dissection. You can see how thin the capsule is. So I'm going to go ahead and actually I want to go ahead and cut this out. Remember, it's not only about the capsule but the inflamed tissue around. So let me show you here as I go in. You can see the scar tissue that I removed. That's usually at the bottom part. So if I cut this tissue, you can see you know, this does not look healthy. You can see the inside of it. Look at the duskiness, the color of the fat. So this is what I removed. Now if I touch it here, you can see it has some nodularity to it. As I cut this halfway through, you can see, look at the scar tissue. This is why I removed it. It is not pure fat, it is not breast tissue. So as I go in, let me go ahead and turn this around. En Bloc, the gold standard. You can see this band that's running through, that's part of that capsular contracture. So I'm going to go ahead and grab this area. So you can see, look, this is very interesting. You can see some fluid, right? Look at the fluid inside. Or I should say it's wet. I just want to go ahead and also show, look how thin the capsule is. You can read right through it. We hear this all the time. The capsule was so thin, my surgeon left it behind. No. You want to remove it en bloc because you don't want this fluid to be spilling into the chest. God knows what is in it. You know, and so what I'm going to do is I'm actually going to cut only that part. It's like weeping, if you will. And so look at this fluid around. Now if I go in, this is, I'll place it here. En Bloc, that's the key, the gold standard. Look at this. This is why, you know, if I had a ruptured implant, this is not ruptured by the way. You can see how this gel bleed is occurring, and on the inside, as you will see, there's no frank fluid that I can send. Now I want you to see how transparent thin this sac is, if you will. And this is complete En Bloc. You can see again how thin this capsule is. I can put it right over this ruler. You can read inches, 1, 2, 3. So I'm overall very happy. Look at this small amount of fluid. It cannot be sent to cytology, but again, this is, look, this is the gel bleed. This is your, I'm actually going to go ahead and get this. So there is no imprint, no I see over here it says Mentor
350.
Mentor 350, exactly. So Mentor 350 is a very nice fine print, blank print. I'm going to go ahead and put this here. I remove my top glove. We're going to focus onto the left side, grade 4 capsular contracture. She En Bloc, she had pain. Now one thing I don't like over here is, look at this bulge, and this could indeed be part of the contracture. And overall very happy with how the whole dissection has gone. If you look carefully here, this is part of the cartilage that was sitting on top of some tissue that I removed that was inflamed. And so let's go ahead and cut this open and we'll see if this is ruptured or not below the muscle. Very tedious dissection. Look at this contracture band. Again, you can see how weepy this is. This is a contracture band right here. I'm going to cut right through it. Very hard. And I'm just going to go ahead and see. Look at this. None of this fluid. You can see. Look, if I go like this, none of this spilled into the chest. You don't want to. If I take this and wipe this fluid off, you can see there's quite lots of it, but not enough to be sent to. And if I go like this, just like it did on the other side, you can see this is what you call the gel bleed. Now the other thing over here, you will see so thin of a capsule. And if I go like this, so not ruptured implant, but a lot of inflammation. You have the contracture band on the inside, and overall you can see my green glove here, relatively thin capsule. So I'm going to go ahead and again look at this. This is the highlight of this video. You can see that small amount of fluid. We don't want it to spill into the chest. There's an essence of doing the En Bloc. Even though when you're not sure, you have to assume all implants are ruptured to prone otherwise. So the implants will be returned to the patient. Capsules will be sent to pathology to rule out the BIA, LCL, CD30 analysis, which is very rare of rare, but still needs to be checked. Breast cancer, anything abnormal. Cultures will be done for bacteria and fungus. And most importantly, we'll see how the patient does. I actually wanted to do a lift. She was marked, she paid for a lift. And I'll tell you, when I removed this implant with the grade 4 contracture and the amount of inflammation that was present and how she recoiled on the skin, I aborted the lift, and so she's not going to get the lift, and she's going to get her refunds because she did not truly need one, looking at how her breast tissue looks and how well it retracted right on the OR table. And I felt very comfortable and confident in making that decision, and she and I were in sync prior to. She came and saw me a week before, and we talked at great length from the first time we had talked. And so I'm sure she's going to be very happy with her natural aesthetic recoil and result. This is Dr. Khan, Executive Plastic Surgery.
Yeah, Kelly, what are you going to